Hey mama, how often do you think about your pelvic floor? Most of us don't think about it until there's some kind of issue, and sometimes those issues can be really challenging to live with. But you don't have to live with those issues, and you can actually use pregnancy as a time to prevent them. In this video, you're going to get a snapshot at the Built to Birth Part 2 course, which is all about the postpartum period, and learn about several ways to help balance your pelvic floor, whether you are currently pregnant or postpartum. So let's jump in right now. So we've learned the foundation for optimal healing and strengthening, which is diaphragmatic breathing. And I hope you're understanding the relationship between this type of breathing and your pelvic floor because they are totally connected to one another. We also know that the pelvic floor is often an afterthought when it comes to healing and proper, well-rounded strength. And yet without proper healing and this balanced strength, so many women experience the undeniable challenges of an unhealthy pelvic floor. So in this session, we are diving a little bit deeper into the pelvic floor and using diaphragmatic breathing in conjunction with some simple, gentle exercises to bring healing, stability, and balance to the pelvic floor during the postpartum period. To start us off, let's discover a little bit more about the anatomy of the pelvic floor to better help you understand its function. So the pelvic floor is a hammock-shaped muscle that sits on the bottom of the bony pelvis, and its job is to make sure that all the organs that are in your abdominal cavity, your bladder, your uterus, your intestines, etc., don't just fall out of this hole that's at the bottom of your pelvis. At the same time, the pelvic floor has a few exits that pass through it, called the urethra, where pee comes out, the rectum, where poop comes out, and the vagina, where your baby comes out. And as much as its job is to keep all those organs floating above it securely in place, it also, when the time is right, needs to allow pee, poop, and babies to pass through as well. So by knowing that, it's understandable why there needs to be a balance between contractility or strength and openness and relaxation. If the pelvic floor muscles are too contracted and unable to relax, it's going to be challenging to go pee, go poop, or even to push a baby out. And we can see that in labors where mama has had to push for several hours in order to have a vaginal birth. But on the flip side, a pelvic floor that is too loose and relaxed can cause mamas to pee or sometimes even poop themselves because of lack of control in their pelvic floors. However, a lot of the time, the only side that's paid a whole lot of attention to is the weakness or over relaxation of the pelvic floor. And sometimes as well, women and really the vast majority of people don't realize that pelvic floor dysfunction is actually pretty common. And for women, it becomes exacerbated during and after pregnancy. These exacerbated issues begin manifesting symptoms that have become very normalized simply because you are a mama who has given birth either vaginally or through a C-section. These symptoms include incontinence, where you lack control of peeing or even pooping, the sensation of having the urge to be super bad and then not being able to empty your bladder, prolapse, where your vagina feels really heavy or the organs that your pelvic floor should be holding up are sagging into the vagina, diastasis recti or ab separation, which we'll be talking more about in the next session, or painful sex. And for a lot of these symptoms, when taken to a non-specialized care provider or talked about with other mamas, the cure is to do your Kegels. And the problem with this is that there is not a one-size-fits-all when you are dealing with the pelvic floor. Because for some women, their pelvic floor is hypertonic, which means it is too tight. And for other women, their pelvic floors are hypotonic, which is when the pelvic floor is too loose. And in order for the pelvic floor to be healthy and fully functioning, you need to have a balance between being able to relax and lengthen as well as to tighten and contract. So how do you know if your pelvic floor is too tight or too loose? Well, the best way to know is by seeing a pelvic floor physiotherapist who can actually professionally assess you. Honestly, for women close to wanting to get pregnant, who are pregnant, and definitely who are postpartum, seeing a pelvic floor physiotherapist should be something of a regular occurrence, about once a year, like a yearly checkup, or more if you're experiencing pelvic floor issues. However, I know that many women know that they should do things for themselves, but still don't do them for one reason or another, be it time, money, or personal choice. So I'm going to give you some ideas on how to know whether or not you may be having a pelvic floor that is too tight or too loose. This advice should not take the place of a professional, especially if you are experiencing pelvic floor issues. Now, if you find yourself peeing yourself when you laugh, when you cough, you sneeze, run, or jump, if you're experiencing organ prolapse or you're lacking sensation during sexual intercourse, those are all signs that the pelvic floor may be too loose. It's like an open hand that doesn't have the strength and ability to properly close and clench. Now, a pelvic floor that is too tight might show symptoms of having the urge to pee, but not being able to empty the bladder, having to bear down really hard each time you go poop, or experiencing painful sex. A too tight pelvic floor is like a clenched fist that can't relax and open up. Now, these are major generalizations because a tight pelvic floor over time can cause similar symptoms of a loose pelvic floor because of the strain on the pelvic floor over the years that may cause organ prolapse. So it really is so valuable to see a pelvic floor therapist who can look at your body, the way you stand and sit, as well as examine your pelvic floor to really tell you whether or not you're too loose or if you're too tight. If you've experienced physical birth trauma like a severe tear or even an episiotomy, you should definitely check in with a pelvic floor therapist because physical birth trauma can often lead to a tight pelvic floor and issues right away and down the road. In general, most women are actually more likely to be too tight over being too loose, which is why, like I said earlier, giving the standard answer, do your Kegels, is not actually helpful at all and can be even more detrimental to a mama's pelvic floor health. So whether you're too loose or too tight, we want to restore and achieve balance in the pelvic floor, which means being able to equally relax and lengthen and tighten and contract the muscles, because having proper control over your muscles means being able to do both. Just like if you were engaging your bicep muscle, you would be able to lengthen and relax and then tighten and contract. That is what we want to achieve for the pelvic floor. If you have a loose pelvic floor that needs to be strengthened, then I would recommend practicing the diaphragmatic breathing techniques every day, especially when you are doing any kind of lifting. Some other exercises that you can do to help strengthen the pelvic floor are the pelvic tilt with thigh squeeze, mountain pose, and staff pose, which I'm going to show you how to do. And remember, with all of these, you're going to want to utilize your diaphragmatic breathing throughout the exercises, because without that proper breathing, these exercises won't be as effective. And all of these exercises you can begin doing as soon as you are feeling ready after birth. They are very gentle, but if you are still in the thick of healing after a birth that involved a 3rd or 4th degree tear or a C-section, then I would recommend waiting to do these exercises till you are feeling better or have been cleared by your provider to do these movements. Even if you are currently pregnant, most of these movements are great to start implementing into your daily routine as well. So the first is the pelvic tilt, and to do this movement, you'll come into a lying down position. If you're pregnant, you can come into this lying down position, but just listen to your body, and if you feel the need to get up, please do. We don't want to spend too much time on our backs because of the pressure it places on the vena cava that helps with blood flow to baby, but a little bit of time is okay, but do what you are comfortable with. Just remember that if you're coming down into a lying down position while you're pregnant, first go onto your side and then roll over onto your back to avoid applying too much pressure on the core, which can add to ab separation. If you are in your postpartum period already, you'll just slowly and purposefully come to the floor on your back and bring your knees up so that your feet are resting flat on the floor. With your hand, feel the side of your back and notice how your lower back creates an arch between you and the floor. This is the area that we are going to draw our attention to help activate our pelvic floor. First, let's take one diaphragmatic breath together on the floor in this position to set us up for the rest of this exercise. Inhale and relax the core and the pelvic floor. And then exhale, drawing together your core and lifting your pelvic floor upward into your body. Now, as you are exhaling with your diaphragmatic breath, that is when we'll do the pelvic tilt. So using the strength of your pelvic floor, not your legs, you're going to tilt your pelvis so that the arch of your back lowers flat against the ground. So breathe in and relax and allow your belly to expand. And now exhale and draw the pelvis in so that your lower back is now fully connected with the ground below. Once it's nice and flat, you'll hold the tilt for 3 to 5 seconds. And remember, you're not sucking in or holding your breath. And then you'll inhale and then relax your core, pelvis, and pelvic floor. You can do this following the inhale about 3 to 5 times and then eventually work your way up to doing it about 10 times every day. The next exercise is a modification of the pelvic tilt, and for this movement, you'll need a soccer-sized ball, a yoga block, or a pillow folded in half. Again, lying on your back, place your object. I'm using the thinner side of a yoga block between your legs, and you want to maintain about a hip width distance between your knees using the object. Let's take a diaphragmatic breath together here. Inhale, relaxing, lengthening, and expanding, and exhaling, strengthening, drawing inward and upward. Okay, on the next exhale, we're going to start with the pelvic tilt as we did in the last movement and flatten the curve of our backs to the ground and then using our thigh muscles to press into the object between our knees. So ready, inhale, exhale, pelvic tilt and thigh squeeze, and hold for 1, 2, 3, 4, 5, and then inhale and relax, lengthen, and open. Once more on the exhale, pelvic tilt and squeeze the thighs together, 2, 3, 4, 5, and then relax. And you'll do that about 3 to 5 times till again you can work your way up to about 10 times a day. The next exercise that I'm going to teach you is actually a yoga pose called Tadasana or mountain pose. And although it's seemingly simple, this pose helps balance your body from side to side, back to front, and from head to toe. And your pelvic floor is all about balance. So to do this pose, come to a standing position and bring your feet close enough together so that your big toes are touching each other and your feet are parallel. Now bring your awareness up to your hips. What we are aiming for in this pose is a neutral pelvis, and a lot of times mamas will either arch their back so the pelvis is tilted forward and their bottoms are sticking out, or they will tilt their pelvis back so that the tailbone is tucked way under and their chest falls forward. To achieve a neutral pelvis, imagine a string running from the inside of your belly all the way through your chest and up through the middle of your head. When it's pulled, your spine lengthens and the tip of your tailbone points towards your heels. Your abdominal muscles draw in and you are facing straight in front of you. This is a good way to maintain proper posture as much as possible throughout the day as well. With your hands to your side facing outwards, take a deep breath in, releasing, lengthening, and relaxing the pelvic floor as your arms move overhead, and then as you exhale, draw your abdominal muscles inward and your pelvic floor muscles upward, and move your arms slowly and purposefully back down to your sides. Let's practice this together 3 times, starting with the inhale. Inhale, exhale, inhale, exhale, inhale, exhale. Awesome job. And because this is such a gentle exercise, I recommend doing it as many times as comfortable, but start with the minimum of about 3 to 5 breaths as you do this pose. And then our last pelvic strengthening exercise is another yoga pose called Dandasana or staff pose. For this pose, you will come into a seated position with your legs and feet in front of you and your back upright. Straighten out your legs, bring your feet together if you can, or keep them just slightly apart if you're not ready to put them close together. And then flex your feet upward so that your toes are facing back at you. If this position is too uncomfortable or you feel the trunk of your body leaning back or curving your chest forward, you can sit on a folded blanket or a yoga block to make it more comfortable and effective. Straighten your spine and roll your shoulders back while maintaining a neutral pelvis. A lot of times in this position, mamas will juxtapose their chest and ribs, which causes the pelvis to tilt out of its neutral position. So just be mindful of that. Your arms are at your sides, and if you can, flatten your palms on the floor or raise your fingers to provide you with a little more upward length, or even bring them out to your sides slightly so that they're not right next to your hips. And really focus on keeping that straight spine, that neutral pelvis, and flexed foot posture. All right, with that posture set, we're going to now draw awareness to our diaphragmatic breath. So for the inhale, envision and feel the expansion and length in your core and pelvic floor. And with your exhale, imagine and feel your core strengthening and drawing in while your pelvic floor lifts and gently tightens. Let's do that breathing together 3 times. Inhale. Exhale. Inhale, exhale, inhale, exhale, inhale, exhale. So it's really nothing crazy, but when you do this properly and purposefully, it's very effective. Start off doing this 3 to 5 times and work your way up to as much as is comfortable for you. You'll notice the pose also becoming much easier as your body learns the posture, and your muscles in your legs and back become stronger and more flexible, as well as your core and pelvic floor. Now, if you're struggling with an overly tight pelvic floor, doing these relaxation techniques are going to help provide length and expansion to your pelvic floor. Mama, that was just half of the video about pelvic floor health and recovery, and there's even more to learn about. Although weak pelvic floors are most commonly talked about, the majority of women actually have tight pelvic floors, especially if you are pretty physically active. Check out builttobirth.com if you want to learn more about your pelvic floor and movements to help achieve optimal balance, and to see hours of practical videos like the ones that you just watched about birth and postpartum. Or if you're not ready to join yet, check out my free mini birth class to learn some more great tips. So thanks for being with me in this video, and hopefully I'll be seeing you very soon over on the Built to Birth online course.